Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Governors, other visitors to take rapid COVID-19 tests before gaining access to the presidential villa. Inoculation exercise continues during the holidays in Edo State as mobile vaccination teams call on public to get vaccinated. And today, India extends vaccination to teenagers aged 15 to 18 over Omicron concerns. Thank you for joining us. Now, the Nigeria Center for Disease Control, NCDC, says it is following up with the University College Hospital, UCH Ibadan, and the Federal Capital Territory, FCT, on infection rise in the respective health facilities. In its weekly COVID-19 situation reports for week 51, the agency reveals that there is ongoing dissemination of key messaging to focal persons across all states on the fourth wave presence and issues regarding intervention prioritization. On its national COVID-19 testing strategy, it says there is a review and update with the ongoing distribution of 400,000 rapid diagnostic test RDT kits to 36 states for increased testing, as well as laboratory consumables, PPEs, and IPC commodities distributed to all the states of the Federation, the Ministries of Health, and tertiary healthcare facilities, including the FCT, in the month of December last year. Well, here's more on the pandemic update.
573 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states, indicating an increase from the figures reported earlier. Lagos accounted for the highest number of cases with 281 infections, Benue 202, Kano 61, while Borno registered 20 cases. Other states, including Jigawa, Edo, Oyo states, logged a single-digit infection. The total confirmed cases in Nigeria now stands at 243,450. The report also includes a backlog of confirmed cases from Borno and Kano states, as well as 0 cases from Ekiti, Ogun, Ondo, Osun, Plateau, and Sokoto states. 572 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 215,352. There were 3 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,039. Currently, there are over 25,000 active cases in Nigeria, while over 3.8 million samples have been tested so far. With over 14,000 positive samples, Lagos State accounts for the highest number of cases on admission, followed by the FCT and Delta State. More than 10 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4.5 million persons have been fully vaccinated. The total global confirmed cases have surpassed 290 million, while deaths are now beyond 5.4 million.
And all visitors, including governors, are now required to take a COVID-19 rapid test before gaining entry into the presidential villa. The Senior Special Assistant to the President on Media and Publicity, Mr. Garba Shehu, who affirmed this in a message, explains that the new development is not unusual, as it is a growing practice in government offices in other countries. He further adds that the test kits, which are issued for free at the gate, is a temporary measure against the backdrop of the recent spike in the number of cases of COVID-19 virus in the country. And mobile vaccination teams at strategic locations in Oredo local government area of Edo State are calling on members of the public yet to be vaccinated to take advantage of the mobile posts and get their jabs. Some of the mobile posts are placed near New Benin Market and the King Square in Benin City, the state capital.
We are here doing our exercise, COVID vaccination. These are vaccination center. KDs at New Benin. Since last week, we have been coming here to vaccinate people. At least the turn-up is a bit okay. This is our first person for this vaccination this morning. So my mobilizer is working. This is my recorder. So we are working together. People have been coming. to vaccinate.
This is a mobile post attached to New Benin wards, New Benin market to be precise. So we've been here since this third phase started, though the turnout has not really been encouraging. But recently, the awareness is increasing by the day. So daily we immunize like 20 persons on a daily basis. Like today now we've immunized 5 persons already.
What we discovered is people are scared. I believe majority of Edo people are scared to take this vaccine. Some people will tell you that I never want to die. I don't want to die. Sometimes you get this sort like, now maybe you want key, you know me you key. So there's this time we had DJ. I usually talk to them like hype woman, like Mona take I know the key. We've taken it, all of us here. We didn't die. The only thing is, fine, if you take it, you notice some changes in your body, like the pains. After 3 days, it goes off. So I think people should be aware that the vaccine doesn't kill.
Well, the reality on ground concerning vaccination there in Edo State. Well, joining us to talk more about this and stopping the spread of the fourth wave, Dr. Dafet Olugboge is the public health physician. He joins us for more on the program. Thank you for joining us, and Happy New Year to you. I'd like to begin. You headed the NMA, the Nigeria Medical Association Lagos Task Force on COVID-19 in 2021. What did you discover in Lagos? And this is in terms of, the operations under the pandemic.
Thank you very much, and Happy New Year to you as well. And thank you for having me on the program this evening. Well, heading the task force for the Nigerian Medical Association opened my eyes and the eyes of so many of my colleagues to so many problems with our health sector. First of all, the Lagos State government, led by Mr. Governor and then the Honorable Commissioner for Health, did and are doing wonderful jobs to ensure that the fight against COVID-19 pandemic in Nigeria and in Lagos by extension is top-notch. Save for their efforts, I'm sure we wouldn't have been where we are right now. We had a lot of issues in Lagos and by extension Nigeria concerning COVID-19 fight, but Lagos was able to surmount. But I think one of the major problems that we encountered or are encountering in Lagos and indeed in Nigeria is the apathy from the general public, the skepticism from the general public, the rumor mongering from the general public, which have created a lot of stumbling blocks to health workers, to planners, to policymakers, to other people in the general public who may want to assess testing, who may want to assess care of COVID-19, and who may also want to assess the vaccination for COVID-19. So these have been the major problem. Then the healthcare system also was not prepared for the calamities and the mortalities and the mobilities that accompany COVID-19. So the healthcare system was overwhelmed during the pandemic, the peak of the pandemic. So the government needs to prepare forthwith for such pandemics, for such emergencies in the nearest future. The general public also needs to be aware. People like us and a host of colleagues have been creating awareness on the TV, on social media, everywhere we care to, we have the opportunity to do so. But a lot of people are still skeptical as to what we tell them. They still don't believe what we tell them. They still don't believe what they are seeing. In one of those clips that you were showing, there was a lady, one of the vaccinators, that was complaining bitterly as to why people were not turning up to get vaccinated. A lot of people were not turning up because they believe that the vaccines are detrimental to their health. So this is one of the issues, religious, ethnic, so many other issues that you can think of that is beguiling our fight against COVID-19 in Nigeria.
Dr. Lugboge, perhaps another question also is, how much are we really seeing? I mean, today someone asked me that these numbers we're reeling out. Last night, Lagos took the highest. Where are they? Who are they? Do they really exist? So if we're hearing that Omicron is driving or appears to be driving the increased hospitalizations, you know, are we seeing the isolation centers? What are they looking like? Or is it home care? You know, how much are people getting to convince them of the existence?
Yes, the numbers and the figures you are seeing, they are not fictitious. They are real numbers. And don't forget that in the middle of November or the beginning of November, we predicted that the number of cases, the number of people who were going to get infected were going to rise up during the Yuletide. And that's because the Omicron variant and the Delta variant were rife at that particular point in time. So people would naturally get infected because they party more, because they travel more, because they engage in large gatherings and social gatherings more. So we are in the fourth wave now. So the figures you are seeing are not fictitious at all. They are real. The human beings, the people who contract these viruses, this virus are real. And all over the world, according to the pattern of what we have all over the world, the number of people who are getting infected with the Omicron and even the Delta variant are on the increase in Europe, in Britain, in America, even in Nigeria. The same story applies. So the isolation centers, there are people there now. We are having an increased number of people who seek health care as day goes on, as the day rolls by, because of the increment in the number of people who get infected with the Omicron variant. And don't forget that at the beginning, we predicted that the Omicron variant will be very, very infectious, far more infectious than the Delta variant. So it is natural that there are increased number of people who get infected, and then as a resultant effect of that, there are increased number of people who would naturally seek healthcare services. So the numbers that you're seeing are real numbers. In fact, I dare to say that if we test more, we will find far more than this in the community. So there are people in the community who get this Omicron, but do not seek healthcare and are taking care of themselves at home, are doing home care in the houses. Yeah, somebody tweeted on social media a couple of weeks ago that some people who come down with malaria or who come down with flu or think that they fall sick during the December period actually had or might have had Omicron. Well, because they didn't get tested, they didn't know or they didn't think it was Omicron that they had. But most of the people who had flu around that period or who are having flu around this period are actually having Omicron COVID-19 viral infection. But because they are not getting tested, I don't know of it.
And even to, you know, verify if it's Omicron, it would have to be genomic sequencing, and that is not necessarily easily accessible. I mean, the RDTs can detect if it's Omicron or not, is it?
Yes, absolutely. It is one of our short doings in this part of the world. If we had the rapid test kit, which I just saw that you televised, that are being used at the Aso Rock Villa, if we had enough of it, a lot of people can, you know, get tested on the go and then know their status as it is. But then again, a lot of people do not have access to this. They have to rely on the PCR testing, which is a bit expensive for them and maybe a bit out of their way. So if we have the rapid test kit for testing, we may be able to pick up more tests, more people testing positive for the Omicron variant.
So essentially expanding the strategy in testing. We'd like to thank you so much, Dr. Japhet Oluboge is a public health physician. Thank you so much for sharing your time with us on this issue.
Thank you very much for having me on the show.
The federal government has introduced several online courses to improve digital knowledge of youth in the country. The president's end-of-year speech, he promised that going forward, the administration would intentionally leverage ICT platforms to create jobs while ensuring that the diversification of the economy creates more support to other emerging sectors. Now, the Director General of National Information Technology Development Agency, Kashifu Abdullahi, who spoke to newsmen, says the digital knowledge will bring more opportunities for the teeming youth across the country.
So, but the committee I'm chairing is on digital transformation.
And away from Nigeria, top U.S. infectious disease expert Anthony Fauci says there is still a danger of a surge in hospitalization due to a large number of coronavirus cases, even as early data suggests the Omicron COVID-19 variant is less severe. The variant was estimated to be 58.6% of the coronavirus variants circulating in the United States as of December the 25th, according to data from the U.S. Centers for Disease Control and Prevention. The sudden arrival of Omicron has brought record-setting case counts to countries around the world and dampening New Year festivities.
And the virus does seem to have a lower intrinsic pathogenicity to it. We're hoping that's the case. But having said that, George, I want to say one thing. We've got to be careful about that, because even if you have a less of a percentage of severity, when you have multifold more people getting infected, the net amount is you're still going to get a lot of people that are going to be needing hospitalization. And that's the reason why we're concerned about stressing and straining the hospital system.
Well, joining us for more on the situation in the U.S., Dr. Nesochi Okeke-Bokwe, an internal medicine physician and international health expert. She joins us from New York. Thank you and welcome to the program.
Thank you for having me on the show today.
Now, Dr. Fauci is warning about the danger of hospitalization surge. How serious is it where you are?
So the situation is quite serious at this time. Even in my practice, I practice internal medicine, so I'm seeing adult patients. And over the past week, there has been a surge of just positive COVID-19 cases in a robust way that I have not seen before. It's almost reminiscent of when the pandemic first began, but at this point, just so many more cases. The good news, though, about what's been happening, though, in light of all of these cases and this surge, my patients that have been vaccinated and boosted, those are the patients that have not had severe illness when they've been exposed to a COVID infection. The downfall to all of this are those that are unvaccinated. That's my hugest concern at this point. It's the unvaccinated patient population where I am seeing more of these hospitalizations with the COVID-19 infections.
So another question comes to mind. What is the sort of national response to reducing it? I mean, are people not getting vaccinated enough?
So people, well, the vaccination rates in the US, they are better than what we see in Nigeria. I think the main thing at this point, we saw more of the surge over the holiday season. More people are getting together more frequently over the holidays. You had maybe a mix of those that were vaccinated, unvaccinated in the mix of things. But really what needs to happen is that everyone needs to receive their vaccinations and their booster shots if they are eligible for their boosters. That's just the bottom line at this point.
So it's also said that early data suggests the Omicron variant is perhaps less severe in terms of, less severe in how it presents or how it attacks the human being. But looking at the presentation, the symptoms, what's been your experience as a health worker, Omicron from the Delta or even the Alpha?
So in my patient population that I'm seeing, some of the symptoms that I'm seeing, mainly fever, cough, runny nose, sore throat, some sneezing. But for the most part, these are all symptoms that can be cared for at home. So it hasn't been as severe, those that have been exposed to COVID-19, the Omicron variant. Pathogenicity doesn't seem to be as severe as other strains like Delta, but with that said, we don't want this to continue to get out of control in regards to more and more cases, because it puts a strain on hospital systems, it puts a strain on resources, and the more of the population that gets exposed to this virus, it's just a worse outcome for the entire healthcare system, for the global community at large.
Would you say that misinformation is also fueling perhaps some of the conspiracy theories and making the job of the government, the health workers, more difficult?
Absolutely. And I think this is something that I saw a lot of in Nigeria. I was actually recently there just 2 weeks ago or so, Nigeria in December, and there were so many people that I came in contact with that just did not have belief that COVID-19 was an infection that actually impacts Nigerians. So many people that I would speak to about it, I went on different interviews, I spoke to different people just in the community, and over, I would hear, oh, it's just something to be worried about in the US, in the Western world, in Europe, which is not the case. There's concern for COVID-19 infections in Nigeria. It does exist in Nigeria, it does occur in Nigeria, and it does impact the population and the community in Nigeria. And my main concern for the Nigerian people is just the sheer rate of low vaccination in the country. And as long as the vaccination rates are that low in Nigeria, it gives the virus ample opportunity to continue to spread in the community, find more and more hosts, to mutate more, and potentially cause more variants to emerge moving forward. That's the major concern that I see in regards to the COVID-19 pandemic in Nigeria at this point.
So I think a lot of work for all of the stakeholders involved here.
Exactly, precisely.
Thanks a lot. Dr. Nasochi Okeke-Bokwe is an internal medicine physician, international health expert. Thank you for joining us.
Thank you for having me, and Happy New Year to you once again.
To you as well. Indian health authorities have started vaccinating teenagers aged 15 to 18 as more states begin implementing tighter restrictions to stem a new wave of infections caused by the infectious Omicron variant. Indian state governments have been administering the doses in schools, hospitals and special vaccination sites. So far, India has recorded nearly 35 million COVID-19 infections and over 480,000 deaths from the disease. Experts believe that both official figures are underestimates. Here's more of the global update.
Pakistan has reported 708 COVID cases in a single day, its highest tally in 2 months, as authorities warn of a fifth wave of infections and makes preparations to try to contain the fast-spreading Omicron variant. According to the National Command Operations Center, the latest data of the past 24 hours pushed the positivity ratio to 1.55%, the highest since October 24. Over in India, the counter has started vaccinating children aged 15 to 18 against the coronavirus as it quickly expands its inoculation effort to cover the world's largest adolescent population, amidst fears the Omicron variant will drive a new surge of infections. Over the past 24 hours, authorities reported 33,750 new cases and 123 deaths. The total number of cases of the fast-spreading Omicron variant detected in India was 1,700. Children in secondary schools in England will be told to wear face coverings when they return after the Christmas holidays to tackle a surge in cases of the Omicron variant of COVID-19.
This is guidance that we are saying to schools that, look, with Omicron, it's much better for a few weeks to have masks in classroom to reduce the rate. It'll keep more children in class, in school, and Omicron hopefully out of the classroom.
French Health Minister Olivier Véran says the country expects to see even higher daily counts of the new COVID infections as the Omicron variant continues its rapid spread around the world. The minister's statements come as tighter measures come into effect as classes resume and Parisians head back to work after holiday breaks. Children aged 6 and over will be required to wear face masks on public transport and in shops, museums and other public spaces. Israelis have rushed to get tested for COVID-19, with long queues of vehicles and pedestrians seen across the country as the Omicron variant infections are rising.
We are 2 hours in the rush. The children with no patient, and they cry a lot and they want to eat. It's problem. We can't do it every day.
I'm here to take a PCR test, and you can see that the line is crazy. I'm not sure that this is the right system to do it, relying on the PCR test as it is right now. And as for the new variant, I'm not sure that the hysteria is making any sense.
Over the past 11 days, daily infections have more than quadrupled in Israel. Israeli Prime Minister Naftali Bennett has said that up to 50,000 people might soon be infected each day. Israel's health ministry says around 60% of its 9.4 million population are fully vaccinated, almost all with the Pfizer-BioNTech vaccine, which means they have either received 3 doses or have recently had their second.
Our website, channelstv.com, has more updates and also a better understanding of the pandemic, plus other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.